so much, Elijah. Before we get started, we like to do our land acknowledgement. We honor the land as the Creator intended, in that we commit to keep it clean and support efforts to make it safe for all. We can show honor to the native keepers of the land by recognizing the value of their culture, by learning the truth of their history and how it shaped this great country. As Elijah said, you are here for one of our most popular presenter. We're so honored to have her, to have this conversation with us. Praising Black children and the complicated relationship to unconscious trauma. Dr. Joy DeGruy theorizes that Black caregivers experience an activation of post-traumatic slave syndrome when non-Black adults praise Black children. In her theory, Black caregivers unconsciously fear that non-Black, often white, will harm or take Black children away. This fear results from historical trauma, from slavery, when a white person might purchase a Black child who was well-behaved or performed in desirable ways. Consequently, when white adults praise Black children, Black caregivers often deflect, reject, or de-emphasize the child's achievement. In this talk, Dr. Crawford will discuss the role of unconscious trauma in Black caregiving. Specifically, she will discuss the Black specific ways praise is given that do not center on majoritized white specific caregiving practices. Additionally, Dr. Crawford will offer alternative theories related to Black praise. Finally, she will focus on the contemporary movements of Black positive caregiving, ways to acknowledge trauma in Black caregiving without judgment, and celebrate Black positive caregiving. You will leave with a greater understanding of Black praise, techniques to share with Black caregivers, and a great appreciation of Black joy. A little bit, and I do mean a little bit, about our speaker today. Dr. Crawford is a pediatric and clinical psychologist. She's a graduate of Howard Temple and Miami universities and has degrees in African American studies, education, psychology, and a certification in nursing. She became a practical nurse when she was 17, specializing in geriatrics. Her experiences as a nurse provided a foundation of understanding racism, prejudice, bias across the lifespan. Dr. Crawford is a scholar in residence at Columbia University's Zuckerman Mind, Brain, and Behavior Institute. Finally, she is a developer of the Crawford Bias Reduction Theory and Training, and serves as a cultural bias consultant with organizations across the US. Please, let's give this one a welcome to Dr. Crawford.
Well, thank you, Fanny, for having me. And thank you, Elijah, for just opening up the space. Like, I don't know, I just love being here. I remember the very first time I met Fanny was actually in this space. And so it's always an honor to be back here. And I know that many of you come to Learning Cafe every single month. My goal today is not the traditional Learning Cafe. I'm actually going to invite you all to raise your hands, to unmute, for us to really have a tender conversation about something that is really near and dear to my heart as a professional, as a pediatric and child psychologist, but also even, I think, on a deeper level as a mom. And so we're going to dig into this and we're going to see what knowledge we can collectively walk away with. And so I really hope that this can be not just a lecture, but an engaged and mindful discussion. So a little bit of housekeeping. I like to use QR codes, and I use QR codes for a variety of reasons. Number one, I want to provide you with immediate access to the resources that I share, and I don't want you to have to wait for the recording to come out and ask how you'll get the slides and all of those things. If you like something that I shared today, please use the QR code to access that website and that material immediately. The second reason that I use QR codes is I want to honor that there are many different roads, many different paths, like this picture illustrates, to coming to knowledge. It's not just going to be one way. We have many different methods. And lastly, I use QR codes as a method and a skill to abolish epistemicide and cultural appropriation. And epistemicide is the process and the method of killing knowledge. And so I want to abolish the killing of knowledge. And I also want to abolish the ways in which we appropriate the knowledge of other cultures and make it our own. And when I say our, I mean specifically in academia. I mean often in spaces like this and where people are presenting. And so my hope is that QR codes are one of those ways to do these 3 different tasks. I want to start with a bit of strategic self-disclosure, as I always do. And the part that makes it strategic self-disclosure is, one, that I'm not telling you all my business, because why? It's not relevant. I'm telling you the things that I think might be most important for you as we engage in this dialogue today. This QR code is a QR code to strategic self-disclosure. It's a clinical practice. And what I do in my work is I use clinical approaches to anti-bias, anti-racist techniques. So the self-disclosures for today. Number one, I'll be using the language parenting throughout this conversation, but I don't think that parenting always means being a parent. There are many of us that parent children every day, and we're not parents. And sometimes parenting does mean that you're a parent, right? So I want to honor both of those spaces. The other language that you might choose to use is a grown-up, and I'll be using some of that today, a caregiver or an adult. The next thing that I have to share, when Fanny asked me to do this topic, because it was Fanny, my first response was yes, of course, whatever you want, right? But my second response was like, oh, do I have, Fanny, not this topic, because the way these kids are set up to teach me, who am I to try and teach anyone about anything related to parenting in this kind of way? I know it from a clinical perspective, but to really get into the intimacy, the vulnerability of parenting it's hard. So I want to just say that, sometimes I wish I could go back to all of my previous patients before I had kids and say, congratulations, you're clean. You made it to my office, right? It's really hard. And so my first disclosure in that is that parenting is hard. And I have more self-criticism than I have self-praise for myself as a parent. And every day that I strive to resolve my unresolved intrapsychic wounds and traumas. And lastly, what I'm hoping to do is I'm really trying to provide some theories for consideration. And also I hope that we can have a mindful and reflective dialogue. So when it comes to the point in the conversation where I ask you to raise your hand and to unmute yourself, you might naturally feel this urge to go into an abundance of words. Resist that urge. Possibly write down some key concepts, really be reflective so we can have a meaningful conversation that helps us innovate in our skills and the ways in which we are engaging in one of the greatest acts that we can, which is ushering the next generation. What a privilege to parent. And so, as I often say in these spaces, I know that many of you are here, and it's nothing like a webinar to really invite presenteeism. And presenteeism is when your body is in a place, but the rest of you is not. And so your body is here, but is the rest of you here? Usually not, because we're so booked up. And I have to say, I don't know when February shifted from being Black History Month to becoming Black Labor Month, but I have found that over the last few years, this is my busiest month of the year. And why is that? That's a tangent, but I say all of that to say, I want us to take a moment to actually be here. And when I say be here, I mean your brain, your thoughts. We're gonna have to put together, all of our intellectual resources, but I'm also gonna need you to bring your spirit in here your soul, your God. And I say God, and I share this often because when I interview therapists all over the country and ask them about what they do when they don't know what to do in the therapy relationship, in the therapy room, in the playroom, they said they pray. Now that feels particularly fitting in all presentations, but I have to say, in the conversation of parenting, I've said some prayers that I think probably some great-great-grandmother from my ancestors have said over my spirit, right? To really figure out how to be the best person I can be for my children. And I constantly fail in that. And so I'm going to invite you to bring your higher power, if you have one, into this space, because we're going to need him, them, hey, her, whatever, to be successful. And lastly, what we're really going to need is your observing self. And this is the part of you that does not become enmeshed with your thoughts and feelings. This is the part of you that watches and names and makes an analysis about what you're experiencing. So if you notice yourself becoming uncomfortable, if you notice yourself becoming activated, if you notice yourself, starting to feel emotional, watch that thing. Don't get into it. Watch it. Look at it. And so to help us get into this space, this is a mantra from one of my favorite groups in the world, Beautiful Chorus, and they just came out with this new album. I'm dating myself by saying album, but they just came out with this new album record. And I think it's a really wonderful mantra in anchoring ourselves and how much power we have to choose to be mindful. It's about 1.5 minutes long. I invite you to close your eyes or leave them open and read the lyrics, but really start to transition from being presenteeism to being fully mindful. I'll see you on the other side of the song.
Stay mindful, now's the time. Use the focus of your mind. Let it rest upon what brings you joy. Recognize the tension voice. Be mindful. Be mindful. Be mindful. Be
Attention is a choice. So what we're going to be paying attention to and being mindful of is the ways in which we get activated. And we're looking specifically in how we get activated in this conversation, affectively, behaviorally, cognitively, and physically. And these are all examples of how that might show up for you today, but it may look like something else depending on just how you respond when you're activated. You might even choose to write down the words A, B, C, P. So as the activation shows up, you can see it, you can watch it, you can observe it. Now we're doing two different things here, right? So I'm asking you to be very mindful of how you get activated. That's a tool that we're also going to be asking when we're working with parents and families, caregivers, and grown-ups. In order to teach, that activation awareness, you have to have that awareness yourself. It requires a being present in a really engaged way. So let's practice the skills. So when we finish this conversation, you can teach the skills. Now, it is the job of our brain to keep us safe, to keep us comfortable, to help us experience pleasure, and really to have prevention from harm. And not necessarily harm that is physical, but harm that might be emotional, harm that could feel spiritual, harm that really disrupts the ways in which we understand the world. And the four different ways rather that we cope when we are activated is we try to avoid that activation, right? That's what our brain helps us do, avoid it. That's the avoider mode. And I'm asking you to watch that today as we have this conversation. Do you disconnect? Sometimes it looks like silencing people. Sometimes it's using humor. It's shifting the focus. The next way we cope is a superhero. And I find that many people who are grown-ups in young people's lives are guilty of this one, cope in this way, where we try to have, a rescue behavior. We are really driven by sometimes our fragility. We often try and help without fully listening when we're working with families. The next way that we cope is that we have anger or irritability. We get into arguments. We use sarcasm. We're diagnosing the families. And this is really the critic mode where we're moving against that thing that is activating us. And the fourth is the daydreamer mode. This is where we actually stop moving. In the avoider mode, we move away. In the superhero mode, we move towards the activation. In the critic mode, we move against it. In the daydreamer mode, we freeze, we dissociate, we have issues sometimes remembering details, we detach, sometimes there's a distortion. And so these are the four ways that being activated may impact you. And it's a continuum of behaviors, from the avoider of minimization to detachment to withdrawal to the superhero, which is more of a dependency or overcommitment. It's burnout. It's seeing too many families. It's working way too hard. The critic mode is when we really overpathologize and we use condescension. And the daydreamer mode is really this continuum of numbness, of detachment and dissociation. What in the world does this have to do with this topic, right? Some of you are like, I've heard this before, Dr. Crawford. I thought we were talking about praising Black children and the complicated relationship of trauma. Like, what does this have to do with anything? Well, if you notice in this image, it's very layered, right? And it's very intertwined. And there's many different elements to this. And in order for us to have a clear understanding of all these levels, we have to understand what's happening internally for us, so then we can use that knowledge and that tool to teach, to understand, to support. And we have to have this conversation because discussing parenting is just really activating in general, and discussing race and parenting is very activating. Now, you may notice that I'm using the word activated over triggered, and I'm using that very intentionally. When we think about the word triggered, what that means is re-experiencing symptoms of trauma when exposed to those trauma reminders. Many of you may not be triggered today. When people are triggered, they have extreme feelings of being overwhelmed or distressed. When people are activated, they experience those ABCPs that might be a result of trauma, but also maybe a result of socialization, lived experience, vicarious experience. They may be uncomfortable, but not necessarily, it doesn't cause any extreme harm or distress. And it actually could be positive or negative activation. So when we think of being triggered, it's all negative. Activation could be like, oh, I really love working with this population of kids and they're really amazing. But that positive feeling is still an activation, right? It's not your baseline. It's something about that situation that is causing that affective, behavioral, cognitive, and physical reaction. And so to really get a full understanding of this topic, we have to understand intersectionality. It is impossible to have a conversation just about race. It's not possible because there's race, there's gender, there's age, you know, what my generation did versus someone else's generation. There's SES, which is socioeconomic status and money and access, right? Who has the ability to have those moments of recovery? You know, when they say parents should take a time out, you know, you can take a time out when you have support, right? And you can pay for support. I remember when I first had kids, one of my friends who's very, very wealthy had said, why don't you get a night nurse? And I said, well, who's going to pay for a night nurse, right? It has to do with religion and our beliefs about where and how we're supposed to raise children. They should be seen and not heard. What is the saying? Spoil the rod, or spare the rod, spoil the child, right? It has to do with our sexual orientation and the ways in which there's intersectionality of even our belief of like relationships, and so forth and so forth. So when we're having this conversation, it's never just about race. It's always intersections and the intersection of those identities with power and with privilege, with oppression, marginalization, and minoritization. And so let's get into this first layer of the PTSS. And thank you so much, Fanny, for reading the description of Dr. DeGruy's theory about post-traumatic stress syndrome. This is her QR code is to buy her book. Since we're referencing her materials so heavily, I really encourage you to support Black writers. It's Black History Month, support all writers, but since we're talking about Black parenting, please buy this woman's book. But what she really discusses is the ways in which the trauma of enslavement continues to have a lasting effect multiple generations later. And how not only the trauma related to enslavement, it's the trauma that happened post-enslavement. Jim Crow, it's the trauma that has to do with desegregation. And by the way, New York never desegregated. We know that our school systems are the most segregated school systems in America, more than the South. And so when we think about that trauma, to all the way thinking about 2020 and the recorded murder of George Floyd, or even January, and thinking about the recorded murder of Tyree Nichols, right? So these traumas keep being layered on and layered on and layered on, and people adapt, going back to those coping responses. We have to survive, right? So the brain does what it's supposed to do, which is in that training mode of being reactive to cope, to exist, to survive. So here's your warning. The content that I'm about to play is activating. I've given you some tools to watch that activation. I've given you some tools of some things to write down and to keep track on. And after this video, I'm going to give you 1 minute to reflect, and then I'm going to open it up for a dialogue. In this video, Dr. DeGruy talks specifically about her theory and really paints a picture of what are we talking about. Sometimes we can look at these words and say, oh, okay, enslavement, but really getting into the trauma of enslavement and the ramifications of that generations later.
So often ask my audiences, I said, how many Black people in my audience? I asked them, how many of you have ever met a Black person that isn't Black? The Black person that will try to be anything else. Oh, did I mention how much Native American I have in me? Oh, and I understand based on my DNA now that my people come from Switzerland. All of a sudden, anything that I can tell you that will convince you that I'm not Black, right? And everybody Black knows that. Well, I have another word for it. It's called post-traumatic slave syndrome. Post-traumatic slave syndrome is exactly what it sounds like. It's multi-generational trauma, intergenerational trauma, as it relates to people of African descent. Being separated from your native land, being beaten, being sold, being raped, being experimented on, any number of things. As an enslaved African woman, you had no rights to your own body. No rights at all to your own body. And it didn't start when you were a woman. You know, that's the other kind of mythology when we talk about rapes. We're thinking about women. You think they waited till they were 18? You think few girls got to teenage years without having been raped? To imagine being a mother. Someone just comes in the middle of the night and says, you know, we have some visitors. They like young ones, so we're gonna pass her along. to the visitors that night. So you can't wrap your head around that. And we want to really believe that, well, that just happened a couple of times. Well, according to a mid-1800s census, there are over 600,000 mixed-race babies born. That's a lot of sneaking out back.
You know, in this video, she says, girls, not just women, but I want to complicate the narrative and also say boys, right? It wasn't just girls, it was also boys. And I want you to think about what would happen to one's parenting. What might you want to teach your children if this was the reality of what you lived in? And what might a grandmother teach a grandchild and a great-grandmother, right? Because one thing we do know is that many Black communities are not in isolation. We raise our children collectively. And so I want you to take a moment to just reflect on what gets activated for you and really hearing these concepts. You have a minute. All right. So I'm going to ask you to raise your hand and unmute yourself. And my question is, what gets activated hearing this content? One part of the question. And two, how do you theorize that someone's parenting would be adjusted with this reality? Yes, Rebecca.
Yeah, so I certainly felt my body being activated and going into some of that, what we would call that daydreamer kind of shutdown mode. And so for me, staying engaged and sticking with it through the discomfort was really important. So I noticed I was squeezing my stress ball while watching. And so to answer your second question, by staying engaged, I can really understand the need to protect our children. And so I'm going to work through the discomfort and continue squeezing my stress ball so I can continue to hear more.
Yeah, thank you so much, Rebecca, one, for the courage of unmuting in this space. And then two, for your disclosure and very mindful reflection. And then three, identifying what coping skill you would use to manage that discomfort rather than just coping with it. And that word, the need to protect. And I often think about protect from what, right? It's the protection from this inhumane harm that no child, that no human should ever have to endure. I see some comments in the chat. I'm going to read them and then I'll invite Laura to join. Knowing these stories are true, and also that America is in denial of hearing these stories in Black history. As a parent, you want to protect your child by any means necessary. Yeah, I think often America is in denial. I'll say specifically, I think many of us use the avoider mode to cope because it's excruciatingly painful. It's excruciatingly painful that this is our history. This is all of our history. It's not Black history. It's not white history. It's all of our history that this has happened. I prefer not to unmute because I know I'm working with a few people on this call, but I was really activated. And I immediately had this visceral behavioral reaction and shut down as a trauma survivor. But I could imagine teaching children to stay quiet, to listen, and don't make a fuss. Those would be your parenting goals, right? Like that's what you would want to teach your child. And as you hear this too, you know, what I think that's so critical is recognizing like, where do you try and get power, right? Where, if you're powerless as a parent and you can't control anything, like that is not an area that a parent can exist in. And so you start to make up spaces of power. Like if I could teach my kid a certain way, maybe I could prevent it. Maybe if I was different, maybe I could prevent it. Maybe I could keep them safe because that's what the brain is trained to do, to figure out. Sometimes the brain puts a lot of stories in place of things that are not solvable, right? There's no solution to being an enslaved person and people having power to come in to either kill you, kill your child, or then to take them. But the brain is going to make you think like, okay, if I teach my child, I could teach my child how to keep themselves safe from an adult. That's impossible. The adult has to change, not the child. But because it's so unimaginable to like accept that truth, we create coping strategies, right? The avoider, the superhero, the critic, and the daydreamer. Laura, if you could please share.
Thank you. I felt
we can't quite hear you, Laura. Could you maybe a little bit closer?
Can you hear me now?
We can.
Yeah, thank you.
Thank you.
I felt in the body, like my heart started pounding faster, and also tearful. I was doing some coloring that helped me to pay attention, but you know, I stopped because I was engaged with your PowerPoints and what we were talking, but I went back to doing that as a coping mechanism. And I thought that the parents of those children probably told them to be as invisible as they could be for the adults that will come and take them.
Yeah. Thank you so much, Laura, for sharing, you know, what you did to cope, right? And so what we're striving to do is to not cope, but to engage, to start to unpack this, not to cope with it, but to look at it, to fully be present with this thing, what shows up for us, because that's what's showing up for our parents. And giving them a stress ball, giving them a coloring sheet, although may be helpful in coping with all of that physical stuff, parenting is very active and engaged, and you can't cope your way through it if you are striving to have specific parenting outcomes, such as joyful people that care about humanity, that not only don't do harm, but also lead and heal and just are fully themselves. That's not coping parenting. That's very active and engaged. And so if we can't even engage in just a segment of a video that wasn't even 5 minutes long, how are we possibly going to be able to engage in this type of conversation with the parents we work with? So we all have some work to do in order to help our parents that we work with. Thank you all so much for sharing. And so as we think about how this manifests in parenting specifically, you know, Dr. DeGruy, she gives this example of the scene of which a white woman starts to shower a Black mother son in praise, like, oh, he's so smart, he's so beautiful, he's all of these things. And The mother then responds in criticism. Oh yeah, he is, but he needs to do his homework. You know, he needs to listen better. And she says that this happens because of the threat of the white praise that is historical, right? That there is a historical piece going back to those days when she described it was a whole lot of going out back, right? And it's the current trauma. So the other day I tried to think about what are the things that I'm most afraid of for my children, for their future. And I'm looking at my dry erase board. And the things that I wrote is that my daughter is going to have to be stronger and tougher. And my son is going to have to be softer and smaller. And why do they need to be these things? My daughter needs to be stronger because she's so soft and so sweet. She's so skilled at feeling all the feelings. Every feeling, she feels it deeply. And so she's going to have to be stronger because the world is going to chew that up. And my son, who is so strong and is a protector and an advocate and will tell someone on the street, put on your mask, he's going to have to be softer because the world doesn't respond well to strong Black men. And so this is historical and current trauma. And so the brain is doing all the things it's supposed to do and making me think about all of that in my parenting. That's both my ancestral inheritance and also my current reality. And so some of the assumptions that I have that come up in this theory that she presents, that Dr. DeGruy presents, is that it implies that Black children aren't being praised, right? So like, this white person comes and praises our children, and then we respond by watering down the praise. But that has to do with the white gaze. There's so much more to Black parenting that's not about white people. It also implies that, you know, our love is too tough, that tough love is too much. It also attempts to rationalize trauma-inducing parenting. Like, you know, of course, Black parents, you've gone through all these horrible things. So of course you wouldn't praise your kids. Like, that's why you're going to be tough on our kids. Like, there's some trauma if we are making our children smaller. And it raises that same question to go to that point. Is this really creating and passing on generational trauma? The things that my family, my ancestors that survived, the only reason I'm here, they taught me to survive. Am I passing on survival? Or am I passing on thriving? Is my goal to level up, right? Is that the goal of Black parenting? It's not only survival, it's to take that survival and make it more. And so the implications of ineffective praise, you know, in general, if we don't praise children correctly in an effective way, like for the brain, not specific to Black parenting or non-Black parenting, but ineffective praise. If we don't praise children or raise them right, they'll be entitled, they'll have a pretty bad attitude, they'll have limited motivation, and they'll be underachievement. That's the general. When I think about Black parenting and the implications of ineffective praise and like not raising our children well, it's all of these things. And it has to do with the harm that majoritized people might do to my children. I often wonder, what are the fears of white parents? And I often think, what would it be like to be a white mother and every day be worried that my child might grow up to shoot people in a movie theater or in a school and really become a domestic terrorist? But we don't talk about those things. We talk about all of the trauma related to Black parenting and that history. And we don't bring in what happens when there's ineffective parenting, because both of those are harm. One has the potential to do harm to others, and the other has the potential to be harm. And all of it is us trying to use our rational brain to believe that there are ways that we can avoid these things from happening without really understanding the bigger world that we're raising children in. And what I find is that there is a humanitarian crisis for all of us. But we're not talking about parenting in general. So that's another lecture. We're talking about Black parenting. You know, it's interesting, the Stanford professor who's the praise person says that we totally missed the mark on praise. And we have so much focus on effort, that we don't actually focus on a growth mindset. And I think that's what I have such a problem with in this theory by Dr. DeGruy, is that it doesn't include a growth mindset. It's the stop point of trauma, which is often the case. But I don't think that this stop point of trauma is where we're at. There's actually a lot more happening in Black parenting that isn't that moment that is about the white gaze. It isn't just survival parenting where we're yelling at the child or not seeing them in their fullness because we're afraid for them. It's some of it. Some of it is, survival parenting. But we also have to dissect this very notion of looking at Black parenting through the white gaze. Because what I hear in this white parent is praising, but what are they praising? What we often find is the nature of compliments from majoritized people, not just white people, majoritized people, are often anchored in the things that culture values: good behavior, they're beautiful, they're smart. It doesn't necessarily have to do with seeing the child as a full person. It doesn't have to do with actually knowing that kid. That's something a stranger can say about your kid because they see you on the subway talking to them and the kid says something funny, right? It's not actually a compliment of anything that the child has a choice in, right? Their effort, their compassion, like their heart. And so it continues to be anchored in the values of the white gaze of what the majority wants to see. And we have to make sure that some of these positive stereotypes aren't anchored in the assumption that there is a lower, that there is less, right? So often when someone might say, like, your child is so beautiful, it's the implication that why wouldn't they be beautiful? Like, aren't children just beautiful and delicious and amazing, right? You're so articulate. It's the implication that people like you are not so articulate, right? So some of these compliments that are very positive are not actually positive, they're stereotypes. And so when I think about Black parenting in the areas of innovation, the innovation of gentle parenting, not just positive parenting, we have to go back to some of the literature in psychology. So transference is this idea of there is a trauma, there is a hurt that you come to therapy and you transfer that hurt that came from a person, that hurt that came from an experience, and you transfer it to the therapist, and then there's a corrective emotional experience. That's often what is happening in parenting, right? Like there was something in your childhood that maybe didn't feel great, and you're transferring that hurt onto your child and correcting it. Right? You're doing it differently. And even if you had a beautiful childhood and a perfect childhood, the world is still very traumatizing. And so you're still transferring that and making sure that hurt doesn't happen to that child. The critical part becomes our own countertransference in the ways in which our own experiences keep getting activated in the parenting experience. Our countertransference is not just the transference of the things that are happening externally, it's the ways that our very experiences are activated. It's all the stuff that we started this conversation with. It's that affective, behavioral, cognitive, physical reaction that shows up while we're trying to engage in this parenting dialogue as the parent, as the supporter, as the provider. And so understanding that countertransference, going through that process that you went through and watching that video, those ABCPs, when you're looking at, oh, I feel this way, I am thinking this, I'm doing this thing, my body is doing that. Okay, do I want to avoid? Is there a superhero? Is there a critic? Is there a daydreamer? Once you have that data, you start to be able to say, I wonder if this person who is a parent in my office is having the same experience. And you start to anchor it in their humanity, not in this caricature of their identity of Black parents who have an inheritance of post-traumatic slave syndrome. It starts to be anchored in, yes, that history, but also anchored in the knowledge of your humanity and in their humanity and in that child's humanity. And it becomes very relational and humanizing. And often when we have these conversations related to Black parenting, these conversations related to caregiving children, we don't even look at children as full people, right? They're always a becoming. When the child grows up, what will happen later, what is going to occur, how they become, as if they're not a being right now. And so by anchoring ourselves in the countertransference and the transference, what we're able to do then is start to bring more humanity, more nuanced, a deeper understanding of that parenting relationship. And so it becomes really crucial that we bring all of these elements, the understanding of our reactions, the understanding of how people cope, the understanding of the bigger, more complicated, more nuanced, no shortcut, no stereotypes, no using these social categories to determine someone's experiences, but instead being real, being present, being mindful. All of these elements, these are the skills that are going to be crucial for us to really understand not just Black parenting, but the parents, the child that are there with you in that moment, their real lived reality, which is really the humanitarian work of it. And so I want to talk a little bit more when I say this gaze, this white gaze, and how we center so much of this work. I want to talk about it in a way in which maybe it can flip a switch for us. And rather than me using my words, which could never be as amazing as Ms. Toni Morrison's, I offer this narrative of understanding how we need to shift the conversation away from this white gaze into this space of looking at the experience of Black parents.
It's shocking. It's always shocking. And I insist on being shocked. I'm never going to become immune. I think that's a kind of failure, to see so much of it that you die inside. I want to be surprised and shocked every time.
You have in your writing certainly marginalized whites. Why are they of no particular interest to you, or seemingly no particular interest?
Well, I was interested in another kind of literature that was not just confrontational, Black versus white. I was really interested in Black readership. And I wanted to do, I think, for me, the allegory or the parallel is Black music, which is as splendid and complicated and wonderful as it is, because its audience was within its primary audience. The fact that it has become universal, worldwide, anyone, everyone can play it, and it has evolved, is because it wasn't tampered with and editorialized within the community. So I wanted the literature that I wrote to be that way. I could just go straight to where the soil was, where the fertility was in this landscape. And also, I wanted to feel free not to have the white gaze in this place that was so precious to me, which is the work.
And you will maintain this safe place for yourself, for your art? You don't think you will ever change and write books that incorporate white lives into them substantially?
I have done.
In a substantial way?
You can't understand how powerfully racist that question is, can you? Because you could never ask a white author, when are you going to write about Black people? Whether he did or not, or she did or not. Even the inquiry comes from a position of being in the center.
And being used to being in the center.
And being used to being in the center. And saying, you know, is it ever possible that you will enter the mainstream? It's inconceivable that where I already am is the mainstream.
Oh, no, that wasn't the implication of my question. I think you are very, very much in the mainstream. It's a question of the subject of your narrative, whether you want to alter the parameters of it, whether you see any benefit in doing that, or will you clearly see disadvantages in doing it from your own point of view?
Artistic disadvantages. There are no pluses for me. Being an African-American writer is sort of like being a Russian writer who writes about Russia, in Russian, for Russians. And the fact that it gets translated and read by other people is a benefit. It's a plus. But he's not obliged to ever consider writing about French people or Americans or anybody.
When we were talking earlier about you being or not being in the mainstream, you are sure in the mainstream when it comes to public acclaim.
I can't tell you how satisfying it is to know that I have earned a readership that is that large as it is. I stood at the border, stood at the edge, and claimed it as central, and let the rest of the world move over to where I was.
And so when I think about that ending quote of standing at the edge and the next level of innovation from survival to thriving in Black parenting, it's liberating oneself from the white gaze. It has nothing to do with the ways in which a white person compliments a Black child. It's the liberation from even needing to have that conversation, to focusing on what are the things that make parenting so beautiful, so amazing, so powerful, so effective, that even in spite of some of the most hideous things, we raise children that love, that heal, that give the world Black girl magic and Black boy joy. It's the space now and the call of carving out something that isn't about the trauma. We survived it. Now it's about the Black gaze, the Black experience that is independent of the assessment of the white gaze. And so love looks different in different cultures, and that's a wonderful thing. And I just wanted to bring up a couple of cultural things to highlight. So this image is from an amazing artist, and she just does these snippets of like Black moments. And the quote here is, "Black mamas, I know I said I wasn't getting you nothing, but..." This is a common Black quote I've heard throughout my life, where your mother pretends that she's not gonna get you anything for the holiday, and then she gives you all the most amazing presents ever, and then you're so surprised, and there's this whole ritual, and you see her sitting there so casually, even though she engaged in a huge labor of honoring and making sure every child was seen, right? That's what this image means. That to me is Black parenting in its beautiful ways. I think about this image, and what I see here is the little girl getting her hair done. Now, the praise that is happening here is this little girl is able to have a very elaborate hairstyle. If she wasn't going to be able to have this hairstyle if she didn't engage in a certain behavior, sitting still, waiting for mom to get all the supplies, going through the ritual, and you see her replicating that same love, that same joy with her baby, right? This is the beauty of Black parenting. I think about the Black parenting of service. And here you see 3 different generations providing food. You see, again, this little girl with this amazing, elaborate hairstyle. You see some traditional dishes for that family. And all of these things are the ways in which we are showing up that may not look like praise. And it's not even about that. It's about what's happening over here. And so there's an entire movement of gentle Black parenting that is happening. It's a healing alternative to survival-based parenting. It's led and really central in Black momfluencers. It's really reparenting that own inner child that parent originally had to get to survive, to now moving to this point of healing those unresolved intrapsychic wounds. It's the thank you for the survival, and thriving is next. Thank you for helping me survive. Thriving is next. It deepens your love and understanding for your own parents and the things that they had to sacrifice in order for you to level it up. And I think in summary, gentle Black parenting, positive Black parenting is remembering and reclaiming who we were before all of the heartbreak. What does it look like to just raise our children in love and in light? And so with that, I will stop. I invite you all to provide some feedback. And I just invite you to anchor yourselves, not in the space of the white gaze and this wonderful theory that is presented, but also to evolve and level it up to this next level. Thank you so much.
Wow. Wow. Oh, Dr. Crawford. My. That wasn't exactly what I asked. That was so much bigger, as I am not surprised, but it was just lovely. Lovely. Thank you. For all of you who are on, please, we beg of you, complete the survey. Cut and paste it, or just pull it up on your Google account and just complete it for us, because we'd like to hear from you. We really would. This was a phenomenal presentation, as always. And I know many of you enjoyed it. So I just want to again say thank you, Dr. Crawford. Thank you all for being here with us. We know you could have spent your day or your hour with someplace else, but we just want to thank you for spending it with us. And we just hope you have the best day ever. Enjoy. Oh, Dr. Crawford.